afternoon, ma'am. I am Catubig. So today's video demonstration, I'll be performing modified sponge bath. So, modified sponge bath is a bath in which our patient is cleansed using wet washcloth deep in the water. So, let's start. But first things first, we really need to do hand washing or hand hygiene. Then, after that, it is the time to explain the procedure, speak clearly, softly, directly, and maintaining eye-to-eye and maintaining face-to-face contact with our patient if possible. But before that, we really need to greet our patient and identify our patient. So, good afternoon, ma'am. I am your CNA today. I am Catubig. What's your name, ma'am? So, then after that, it is really important to take the temperature of our patient before going to the procedure. Then after that, it is the time to get it. So, normal room temperature, ma'am. Then, after that, it is the time to provide privacy, close windows, curtains, and door as well. Then, it is the time to get the gown of the patient. Make sure to ensuring that the chest and the lower part of our patient is covered. And soil this use gown in a solid waste container. Then, before going to the procedure, it is very important to check the temperature of the water and ask the patient to verify the water. Ma'am, ilay na to. Check if okay your body temperature. Then, after that, it is the time to put on clean gloves with Then, it is the time to start the procedure. Beginning with the eye, make sure to use a wet washcloth with no soap. Make sure to wash eye with different area of the wet washcloth in each stroke. From the inner aspect to outer aspect. Then, proceed to the face. Then dry face with this dry towel. Then after that, let's proceed to the arm. Make sure to expose one arm at a time. Then, again, we need to put this dry towel underneath the patient's arm. Let's go first in the farther arm because it is the proper way to wash the hand. Then, apply soap in the washcloth. Wash finger, including fingernails, arm, hand, arm, and then underarm. And then rinse. Again, from the fingernails, hand, arm, then underarm. Then it is the time to dry arm. Then, it is the time to proceed in the nearer arm, using the same technique as the farther arm. Again, wash with soap. Again, wash from including fingernails, hand, arm, then underarm, and then rinse. Again, fingernails, hand, arm, then underarm. Then dry. Then after that, it is the time to move body gently and without the force and overextension of the joint and limbs. again, we really need to put this dry towel underneath the back of our patient. Again, secure the privacy of our patient. Again, wash with soap. Then wash. Then rinse. And then dry. Then position your patient in Then after that, we really need to change the water because we are going to clean the legs later. Then after that again, it is the time to wash the client's leg. Again, exposing one leg at a time. Exposing one leg at a time. Again, we need to wash the farther leg first. And again, we need to put this dry towel underneath the patient's leg. Again, we wash. From least contaminated area to most contaminated area. In this procedure, we need to firm stroke the leg. Then rinse. And then dry. The next, let's proceed to the nearer leg. again from least contaminated to most contaminated area. Then rinse. And then dry. Then after that, it is the time to give patient clean gown. Make sure the privacy of our patient. Then after that, it is the time to do aftercare of our equipment. Empties and rinses dry basin. Then place basin in a prescribed area, dirty supply area, which I do earlier. Then dispose linen in a soiled linen container. And avoid contact between candidate clothing and use linen. Then after that, it is the time to remove and dispose our clean gloves. And put it in a waste container. Then wash hand or do hand hygiene. Then signalizing device is in reach. Signalizing device is in with reach, and the body mass in the bed mass in lower position. That would be all. Thank you.